ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello, welcome, and thanks for tuning in to ECDC On Air, the podcast of the European Centre for Disease Prevention and Control. I'm your host Lee, recording from my headquarters in Sweden. Today, if you're listening on the 24th of March, is World Tuberculosis Day, to raise awareness about the global epidemic of TB and the efforts to eliminate it. While you may think TB is a very old disease, indeed it has been around for thousands of years, it continues to be a very real and current problem. Every year, ECDC, along with the World Health Organization, releases a surveillance report to give an overview of the situation in Europe and identify the challenges when it comes to addressing the disease. We sit down today with Veronica Cristea, Scientific Officer here at ECDC, to discuss the current burden of TB in Europe and some of the key findings of the report. So today we're joined by Veronica Cristea, Scientific Officer for Tuberculosis here at ECDC. Veronica, welcome. Thanks for joining us.
Thanks for having me.
So today we're going to be talking about tuberculosis, which today is World Tuberculosis Day, where we would like to raise awareness on TB in Europe, but also because we are releasing a new surveillance report on TB. So before we really get into it, what is TB? What do people know? What should people think about when they hear TB?
Tuberculosis is actually a bacterial infection. So you get tuberculosis by air. You inhale that bacteria into your lungs, and then it can sit into your lungs without being active, and that is called tuberculosis infection. And currently, the data shows that approximately a quarter of the world population has tuberculosis infection. But that doesn't mean that you have a disease active with symptoms. So you can stay into this phase for quite a while. It doesn't even mean that you can always develop active tuberculosis. But at some point, your immune system might not cope with this bacteria in your organism due to different reasons. And that's when you have the possibility to develop active tuberculosis. And that's when you usually start to have the symptoms, which are cough that doesn't go away with any type of medication, and that persists for more than 3 weeks. You start to lose weight unexpectedly. And then you also have night sweats and you are very fatigued. So these are the main symptoms that point out to a tuberculosis case.
It sounds like it's very similar to other respiratory viruses. The symptoms sound quite similar. Is that a problem when diagnosing it?
Yes, because as you know, tuberculosis is not very common in Europe. Like, we are part of the low incidence countries. The notification rates are quite low in our areas. Usually the doctors do not suspect a tuberculosis case quite immediately. So it's very important to give all the information. Like, if you have traveled somewhere, especially in high incidence countries, that's very important for the doctor to know, to be able to suspect this. And also, if you were a contact of someone that was recently diagnosed with tuberculosis, it's also very important to let your doctor know. Although it's not common, it's still a disease that it's transmitting and in the European region, so then it is a possibility that you can have tuberculosis.
Okay, so going back to this surveillance report that's coming out now, you said that Europe isn't really a high incidence area for TB, but could you give us an overall idea of the situation as it is in Europe? Things getting better, or are they worse, or are they staying the same?
If we discuss the recent numbers that got published today in the European joint report, you can see that actually in the past 2 years, the number of tuberculosis cases are increasing. And this comes after the COVID-19 pandemic in 2020 and 2021, which impacted very much the healthcare systems in our region. So we know from there that different resources had to be reallocated in order to cope with the COVID-19 pandemic. And that kind of like triggered a bit the tuberculosis diagnostics and patients' treatment access due to all the restrictions that were put under. During those years, we saw a decrease in the number of cases. So if we talk about over 45,000 cases in 2019, in 2020 and 2021, we're discussing about around 33,000 cases, which is quite a big drop. But then when we discuss 2022 and 2023, we start seeing a recovery of the cases that were not catched during those 2 years of the pandemic. And this can tell us that although the systems were under pressure in those years, they are trying to recover what was not able to capture during those years.
So, I mean, we're really still seeing the effects of COVID-19 when it comes to the reported cases.
Yeah, exactly. And this is quite different from other diseases because for tuberculosis, it's not a fast disease. It takes time from the moment you actually get the bacteria until you develop the symptoms. And because of those years, you might see that there are issues in not being able to go and get tested or get the treatment. So there was a delay in those things. But now the systems are back on track and we are trying to capture everything that was not able to be captured during those years.
One of the things that is really evident in the report is when it discusses the incidence rates and deaths. But in simple terms, like, what do these numbers actually tell us about the actual burden of TB on people living in Europe? Who is most affected?
The recent report, as in every year, shows us some different aspects of the population that has tuberculosis in our region. And from that, we can see that the most affected age groups are people between 20 and 50 years of age. Those are the most numbers reported to us. Males are also one of the characteristics. So majority of the cases are more in males than in females. We can also discuss about the fact that almost a third of the cases are reported in people of foreign origin. So if we discuss numbers, it's 3 in 10 cases are of foreign origin. And when I mean foreign origin, I actually refer to people that are not born in the country that reported the case. So they are from outside that country. That doesn't mean that they are born outside the European region. They might be born in the European region. It's just that the moment they got diagnosed, it was not in the country of their nationality.
We have effective treatment for TB, but we also see relatively low success rates of that treatment. Why is that? And what can be done to improve that?
There is indeed a low success rate reported to us, but the factors that contribute to the success rate are different. So it might be that due to the length of the treatment in tuberculosis, usually the treatment lasts between 3 to 6 months. That's the standard treatment. And then depending on the resistant patterns that you have, it might go up even to a year, 2 years of treatment. From my personal experience with patients, usually the treatment it's not that easy to undergo. It requires several pills per day for a long period. So people feel much worse during treatment than without treatment. So one of the causes that we see low success rate might be attributed to the fact that once the person feels that they are feeling better, they do not want to continue with the treatment. Or the treatment is completed, but they move facilities. So then there's no medical record of them finishing the treatment. And then that translates in a loss to follow up into the surveillance cases system. So there are many things ongoing. It might also be the issue where people have to move from one country into another and they lose the possibility of continuing on the same treatment due to low resources in providing the same type of treatment they were on from the initial treatment. There are many reasons that come into that. And I would say what will be good to have and to ensure that treatment success will go higher up will be to ensure equity treatment across all the countries in the European Union and also ensure communication between the countries in regards to the patients that are transferred from one place to another.
You mentioned the resistance. What do you mean by that?
The bacteria can develop resistance to specific anti-tuberculosis drugs. So you can have different type of resistance. The basic ones will be the rifampicin resistance or the multi-drug resistant tuberculosis. And this is usually a more complex type of treatment. You can also have a pre-extensively drug-resistant tuberculosis, but also extensive drug-resistant tuberculosis. So those are the levels of resistance that you can get by having a TB bacteria. In the European Union, there are cases that are mostly rifampicin resistant or multi-drug resistant, but we also have pre-XDR and XDR cases reported.
One of the things that really stuck out in the report is that the progress towards the WHO's end TB targets, they're still quite far off. What are these targets and why are we not on track to meet them? What are the hurdles that we're facing? You mentioned things like travel, people moving from one country to another. Is it just down to that, or are there greater hurdles that we need to work towards overcoming?
I think it's not just up to what you described currently. I think there are more aspects to take into consideration, as there is continuously need to provide better access to treatment and more equal to everyone that has the disease. As you know, usually tuberculosis is known as the poor people disease because of the condition of transmission. It's really well defined in enclosed spaces like prison, campuses, and that type of really enclosed, low condition of living. And then people do not think that tuberculosis can be a disease that they can catch in their own settings. So it's really important to raise awareness and try to implement more type of impactful measures in those specific circumstances. Of course, these targets that we're discussing now are the targets in regards to decreasing the incidence rates. And there are two major time points that we're discussing here is the milestone from 2025 and the end goal from 2030. As I mentioned previously, the European Union countries are already under the low incidence country. And when I say low incidence countries, I actually mean under 10 cases per 100,000 population. So majority of our countries are actually referring to that. And that means that in our context, we're discussing pre-elimination status, which at very low numbers, we need to decrease even much more. So for us, reaching those goals might be more complicated because if you have 10 cases per year to reach this elimination status, you will need to have 1 or 2 cases. So we're discussing actual small numbers and the impact the small numbers have on these targets. So just to wrap up about the targets is that there are currently 3 targets that are under surveillance. So we have the incidence decrease, the decrease in the number of deaths. And also one of the targets focuses on the catastrophic costs, which kind of makes you understand that having TB should not be a choice between having to pay for the treatment or to pay for your conditions at home with your family. So TB treatment should be free for everyone.
Something that really struck me in the report is the rising number of TB cases in children. Why are we seeing more cases of it in children now in Europe?
I think this just gives us a signal from the surveillance point of view. Usually when you see tuberculosis cases in children, that kind of highlights that there is ongoing transmission into the country. So we're not discussing importation of the disease in the European region. We're actually discussing transmission, active transmission in the region. And why we are worried for children is because usually children don't have the TB infection due to their status and their years of living. So usually when you see active tuberculosis in children, that means that happened in the recent period. So there is something ongoing into the countries.
When we do talk about TB in children, are we talking about the same disease? Does it present in the same way as it does in adults? Are there specific challenges when it comes to treatment for children when they are diagnosed with TB? And is it more complicated?
For children, when we discuss and we start from the actual putting the diagnostic of tuberculosis in children, you can imagine that having a child sit through testing for tuberculosis might be a bit challenging, as you need to have different type of samples in order to confirm the diagnostic. Nowadays, the actual laboratory part has evolved quite a lot, so it's much easier to retrieve the samples from the child and actually put the diagnostic. But in the past days, it was quite complicated and quite challenging for the medical personnel, the family, and the child in order to obtain a diagnostic. The overall disease can be in lungs, but then being in children, this might be not the case. Like you can have tuberculosis that it's intrathoracic in your lymph nodes, or you can have disseminated through the bloodstream in all the different organs that tuberculosis usually presents in. And that might be in the brain, in the bones, or even in your kidneys. And you can imagine having this type of diagnostic into a child, it's more complicated. So treatment usually in children is 4 or 6 months depending on the disease, but if it presents under a more complicated site of the disease, then this can be extended. The complication can be very severe in their cases. Usually, if we look at the data that's available now, we can see that the younger children under 5 usually have intrathoracic in the lymph nodes that the disease is presented. And the really severe cases are the ones that disseminate to the brain and you get the meningitis.
Is there an element that because children are so young, they're obviously having to rely on parents or family giving them the medicine and things like that? Is that also a complicating factor when it comes to making sure they complete their treatment?
Well, I think that might be one of the cases, but also the availability of the pediatric formulation of the treatment might be a challenge sometimes because there's different formulation depending on the child's nutrition status and everything. So then you need to formulate exactly to the specific needs of every patient. And that might be a challenge with the current existing medication on the market. But there's also the challenge of the compliance to treatment due to their very young age.
Moving away from children, I wanted to talk a little bit about TB and HIV and how they're connected. Could you explain what the link between the two is and how that affects individuals?
Usually people living with HIV have a compromised immune system. And with every disease, they are more susceptible. So that is very important to know when we discuss an infection with tuberculosis in a person living with HIV. Current literature studies show that a person that has HIV is more susceptible in having a TB infection and an active TB infection we're discussing. So it's very important the moment you receive an HIV diagnostic to also test for tuberculosis in order to prevent further damaging your immune system. Because the moment you have both in your organism, there's a competition across them in order to maintain the immune system. So it's very challenging, and it's also important to know if there's the possibility to have a TB infection in order to treat it, and then you can focus on the HIV treatment.
So you need to really be treating the TB before you can treat the HIV?
That was the case in the past, but nowadays the treatments are more efficient and there is the possibility to start the HIV treatment at the same time as the tuberculosis treatment.
So you mentioned one of the things that we really need to focus on to hit the targets for eliminating TB in Europe, particularly around equity to medicines and things like that. Are there any other must-do actions that we can take in Europe now?
Yes, I think our way to move forward will be to actually prevent ongoing transmission of tuberculosis, and that will translate in early identifying the TB cases, the persons that were in contact with the TB cases to ensure that they receive tuberculosis preventive treatment, which is available, and that will lower the possibility of ongoing transmission. And I think that is the key element here, to early detect the cases and prevent further spread. But then at the same time, we also need to have better diagnostics and more timely implementation of the treatment. So even though in the past years it was a lot of progress towards this, so we have new testings possibilities and everything, it's still a bacteria that needs time to grow. So we need a bit of time to understand if it is resistance type of tuberculosis or not, and which type of resistance. And if diagnostics have more timely impact, that will also be helpful in reaching those targets. And also investments in other type of medications or even vaccines better than the current available ones. Those will also be very useful to have in the future.
We're coming towards the end now. You mentioned some of the struggles TB patients have to finalize treatment. What do we need to do to be more supportive of such patients?
Alongside the report, we're also launching 2 patient stories that are published on the ECDC website. And those stories are really remarkable and really nice to understand the challenges that these people have. So it's not just the treatment itself that is really harsh on themselves, it's also how the society perceives once you receive a TB diagnostic. As I already mentioned at the beginning of this interview, it's very hard for the person when they receive this diagnostic because it's not something they are aware of, most of them. They feel like this is a disease from the past and it's not ongoing in our days. So whenever they receive this type of diagnostic, it's a bit of a shocking moment for the patient. And that moving forward with your social network might not be as easy as they might feel the need to move out from your circle. And that is a very harsh impact on the people that receive this type of diagnostic, because in the lowest moment of their life, they are losing important people that they had in the previous interactions. So that is something that we need to work better, and to understand that if the person is on treatment and the doctor is okay for him to go outside, that ensures that there's no ongoing transmission of the disease and there's no risk for the other people to get that type of infection.
So really, stigma does play quite a large role in whether and how people choose to get treatment, whether they stick with treatment, and they can be worried that they may lose friends and family as a result of the diagnosis.
Yes, but I do think that most of the people that receive a TB diagnostic understand the risk of not going on treatment and not finalizing that treatment. And most of them decide to go on treatment, but at the same time, they need to receive psychological aid and peer support from other people that went through this process, because it's a very tough process to go through. And yeah, we should try to be there for the persons that we know that have tuberculosis.
Well, those are all the questions that I have for you today. Thank you very much for taking the time to come and speak with us.
Thank you for having me.
We hope you enjoyed this episode of ECDC On Air. If you would like to know more about TB, and particularly to find out more about its symptoms, please see the links in the notes of this episode. If you would like to know more about ECDC in general, please visit ecdc.europa.eu or follow us on social media. If you like the podcast, give us a rating and get in touch via the comments.